Hey guys, hey. Hey guys, I wanted to come over here and talk to you guys a little bit about when you get ready to go to surgery, when you're in your surgery, whatever, what actually happens. When you first go to your doctor and you go to your pre-op um, consultation, and then you have to sign a consent form. That when you sign that consent form, you're signing stating that you are aware that this surgeon is going to use an assist with them in the surgery room. You're signing the consent for that to happen. So let's start off by saying there are 5 people on your surgical team. When you get ready to have your surgery, it's not going to be just your doctor in the room. That's not going to happen. It can't happen. Here's the thing. Your doctor, if you go in the operating room and it's just you and your doctor, you need to wake yourself up and get out. That's not logical. Okay. What's going to happen is you have your surgeon that you have agreed to work on you. You got that surgeon. That surgeon has an assist that works with them. Y'all, we got to realize that these doctors are human. Anything can happen. What if he's in there operating on you and he get a cramp in his hand, or if he have a heart attack, or if he passes out or whatever? You're just gonna be laying there wide open, just laying there. So there are so many reasons why these steps are put into place. There's gonna be an assistant in there with your doctor, okay, with your surgeon. Now, your surgeon, he's gonna do what he needs to do. If he decides to tell the first assistant to say, "Hey, I'm done," go ahead and suture him up. Go ahead and close it up. That doesn't mean your doctor didn't do your surgery. That assistant is just closing up the area. That's it. That's all they're doing. Now, those 5 people that are in that operating room, you got your surgeon, the first assist, you got your scrub nurse, you got your surgical technologist, and you got your anesthesiologist. You got those 5 people in the room. Now, your surgeon, you already know what he's there to do your surgery. The surgery assist, he's there to assist the surgeon with whatever he or she needs. If it's suturing, if it's positioning, if it's all these other things, they need help when they're in that operating room. My doctor is Dr. Yealy. Y'all, I'm 5'11", 224 pounds. There is no way that Dr. Yealy, and I'm unconscious too, there's no way she's going to be able to flip me and position me for whatever she needs to do for her lipo, and then do my BBL, and then my tummy. There's no way she can do that by herself. She has to have some assistance in that room. So a lot of people, I've been watching these videos, they're like, well, I woke up and I didn't hear no, my doctor is a female, but I didn't hear a female voice. I just heard men talking. That very well could be. Your doctor could have been standing right there, and all you could hear is just the guys conversating, whatever the case may be. But guys, there will be an assistant surgeon in that room. Whatever they do while they're in there is up to the actual surgeon. Does that make sense? Okay. Now, the circulating nurse that's in the room, she's responsible for getting all the documentation put into the computers, the times, and all of that, when this was administered, when that was administered. She's responsible for all of that. She's also responsible for the count of all the sutures, the needles, the lap pads, anything that they use in that surgery is counted before the surgery actually starts. Now, at the end of your surgery, that circulation nurse is going to go through and she's going to count those things to make sure that they didn't leave nothing inside of you. And y'all might think that's funny, but that has happened. Okay? So that is her responsibility. And she's also, or he, they can get other supplies. If they're running out of supplies in the surgery room, they can go and get it for them. Because the sterile area, the doctors and everybody, they can't leave that room. So that's what she'll go do and assist them with that. Now, the first assist, he helps perform whatever procedure the doctor wants them to do. If it's closing you up, if it's suturing, if it's retraction, whatever it is that doctor needs him to help him with, that's what he and she is there for. Okay? So you put these doctors on a pedestal like, well, they can do all this by themselves. No, they can't. No, they can't. They may need them to hold something open. They may need them to stretch something to do this. They gotta have help. And that's why that team, that surgical team is there. Okay? Now when you get to the scrub nurse, she prepares everything. She gets in there and she prepares everything as far as laying the stuff on the table, making sure that everything's open and sterile or whatever. When I noticed that when I had my surgery, when I broke my leg, I was in surgery for 4 hours. And before I went completely out, I saw 6 people. I was just looking around, and I had 2 surgeons working on me because they had to take my ligaments, my veins, and all this stuff from around the bone that was sticking out the front of my leg and my ankle. They had to work on me, and both of them worked together. So it wasn't just one surgeon. Okay. The surgical technologist. This is the cool job, though. The surgical technologist. What they do is they take everything that's all of the equipment that's used, all of the instruments that the doctor's going to use, all the tools or whatever. He lays them out, or she. I keep saying he or she lays them out so that they're in order and everything, and he passes those tools to the doctor, to the surgeon, or the assist when needed. So they don't have to reach over and try to get something, whatever they say, suture, this, whatever they call them. He just hands them to. That's his job. He hands them to him, and it's also the scrub nurses right there. So if he can't get something or he's not doing, she's watching so she can help as well. Okay. Now the anesthesiologist, we talked about that in my other video. They're there from the beginning, in the during, and after. So they're there, and it's amazing how all of these people, I was looking them up, they have medical background. You have to go to school, medical. You got to know the anatomy. You got to know all this stuff about the body in order to do any of these positions. The only one, I think the surgical nurse, I think she's the only one that does not have to have a lot of medical training. Okay. But guys, anesthesiologist, that's a doctor. I didn't know that. It's amazing how they get this done. They have what they call HEPA filters in the operating room, and they don't have the circulation where it's going around in the room. It's parallel. I don't know if you ever heard them or saw them open up an operating room door. It's whoosh, like that. That's because the air is not circulating whatever it is in the air. It's keeping it parallel. Does that make sense? But it's a pretty amazing. But if you think that your doctor is not doing your surgery, I don't know. Think about it twice. Think about it twice, because there are other people in there that assist, and you have consented to them assisting, because when you sign that consent form, that's what happens. Okay? What else? Your recovery nurse will come into the operating room, and that's when they're going to take the breathing tube out. Once they take that breathing tube out, that doctor can be gone. He's out. He's released. So once you take the tube out and your recovery room nurse comes in, they'll take you to the recovery room, and your anesthesiologist, they're going to check your levels and everything to make sure that everything's okay. But to the people that are saying that when they wake up and they see other people, or they hear other people, or they don't think that their surgery was done by their doctor, just remember that doctor is not in that surgery room by him or herself. They need that assistant. I can imagine Dr. Edie trying to turn me over, my fat ass over by herself. Ain't gonna happen. So y'all, just be logical when you're saying those things. Make sure that you're aware of the circumstances in your surgery. And when you're signing those consent forms, read them. I know you're ready to get your surgery. I know you're ready to get it over with. But all that stuff you're signing, guess what? It's protecting them. Make sure you read it. If you don't agree to something, say you don't agree. But if you don't read it, then you don't know what you're signing. But 9 times out of 10, well, actually 10 out of 10, if you sign that consent form, you're giving them permission to to use whatever means they need. There will never be a case where the surgeon is in the room by themselves. Not going to happen. That's why they're called surgical teams. Everybody works together. Everybody has an important role in that surgery room. Okay. Again, the circulating nurse. She also counts everything at the end to make sure the same amount of sutures, needles, pads, all that stuff is still in the room. So they don't throw the stuff in the trash. It's like bins that they use so that they can count everything. I think that's pretty cool. I'm so ready for my surgery. I don't know what to do. I'm ready. I am going to sign my consent form because I want no reason for them not to do my surgery. As long as my initial surgery is done by my surgeon, I'm fine. I don't care who sew me up. I don't care who do the last whatever. I don't care. As long as my surgeon does the part that I want, because I want to get that look, then I'm fine. I'm fine. So guys, just don't think that your doctor can be in the room by themselves, but they can't. There's just too many things that goes on in an operating room that they have to have assistance. Okay? So, I'll tell you guys if I wake up, I'm going to come up and say, y'all, I woke up. But if I do, I know that the anesthesiologist is going to put me right to sleep, so I'm not worried. But I'm just so ready to go, y'all. Have you ever just done so much research that you just know already what to do? You just need to go? That's the point I'm at right now. So, guys, don't feel like my doctor didn't do my surgery or whatever. If he or she has some assistance, that's fine. But, hey, they can't do it being there by themselves. All right? So, guys, all I can say is stay focused. When you're signing them papers, read them. Read them. Don't just sign them. What else? I don't know. Make sure you're taking your vitamins. Making sure you're doing whatever you got to do. Stop smoking. Stop it. Stop smoking. So you'll be ready. Y'all, I'm so ready. I don't know what to do. But every time I learn something, I'm going to come and let you guys know because I want to share whatever I can. But guys, just know that that doctor cannot do that all by themselves. They're human too. Okay? So if you guys like, share, and subscribe. Love you guys. Bye.